So we'll go around later on checking it out, and then we'll show it to Suki later. Okay, so that's the stent sense. It's open. It's moist and pink. No redness associated with it, which may be seen, like we said, if there's what they call this, as part of complex spots, part of parotitis, and all that. Okay, now we assess the gums. So look at the gums. And keep your. Okay, so gums are pinkish. Okay, you can see the clearly defined margins. Okay, all right. No bleeding. It doesn't look spongy at all. Okay, and then we now assess the teeth. So for the teeth, again, stick out your. Okay, so you're missing one tooth here. I'll just tap. Any pain? Okay, I don't see any cavities, but I'm not a dentist. Alright. And then we also now assess the tongue. So can you please take out your tongue? And this is the ventral fissure.
Oh,
Or the midline fissure.
midline.
Okay. You will see the papilla, it's rough. It provides a rough edge, the rough surface. Okay, now can you push against this? Stick out your tongue and push against the tongue blade. Yep. Okay. Now push against. Alright, good. Now, I will show you the frenulum. Can you lift your tongue? Try to touch. Here's the frenulum.
Oh,
Okay, and these are the whartons.
oh.
Frenulum,
Frenulum.
The one in the center.
in the center. You have the
Phantoms.
whartons ducts.
Whartons.
You see how rich it is in blood vessels? That's why when you do your sublingual, it's easily absorbed.
I see. Okay, makes sense.
Now it makes sense. Okay, so that is for the ventral surface of the tongue. You saw the frenulum as well as the whartons ducts, which are the landmarks. Okay, we also assess the sides of the tongue, okay, with the movement. Okay, now we assess the hard palate. Okay. Can you lift your head? Okay, so hard palate, you'll see the ridges. Okay, and then the soft palate, that back part which is more spongy in appearance. It's pinkish. Okay, so after we have inspected, we will now palpate. So when we palpate, any pain? Okay. Okay, so that is for palpation. Just do it all at the same time so it's, more convenient for the patient. Okay, next, we now assess the throat. So when we assess the throat, again, we look for the landmarks. So the landmarks here will be, okay, your uvula. Do you have a uvula? Okay, there you go. In the middle, can you say ah? Can you see the tonsils? The tonsillar pillars there, the crypts. See it? Like the sponge. It's
You're taking too long.
Okay. Okay. Look at the tonsils. There.
Yeah.
Okay. Upward movement. So
I got it.
pillars, tonsils. Okay. So very prominent. Okay. And when she says you saw the upward deviation of the what they call this, of the uvula. Now, if, like we said, we need to assess also the gag reflex. Okay, cranial nerve,
9 and 10.
9 and 10. Okay, so here I will not really stimulate. Which one will I stimulate to elicit the gag reflex?
The throat.
The back of the throat. Okay, earlier saying the tongue. Huh? The back of the throat. The back of the throat. So I will pretend, I will say, okay, Suki, I am now stimulating the gag reflex. What will be the response?
Vomiting.
Okay. So when you perform this, you should be able to elicit that. So your patient should go, eh. If they do not do that, then you get a deduction. That means you did not elicit it.
Okay.
Okay. So just for the purpose of not wanting the patient to throw up, okay, we do that. Next, we now assess the external nose. So, observing,
Midline.
okay, midline, no lesions, the nasal, the bridge, okay, which forms part of the nasal septum, is not deviated, okay. The collar approaches approximates the rest of the face, okay. And then we now assess for the patency of the airflow. So please close your eyes, pinch one nostril, and you tell me if you can identify here. Okay. Now we test the other nostril. Okay. Recap.
Very strong.
Okay. So earlier with the other patient,
Dark roast, huh?
the other student was saying, I think it smells like chocolate. Really? You drink coffee? No. That's the smell of chocolate. Okay. So ability to detect odors is cranial nerve.
1.
Okay, cranial nerve 1. Okay, and then we now will palpate. Okay, nostril, just feel it. Any tenderness, any lesions, any pain?
No.
Okay, and then we now will need to inspect the internal nose. So like I said, change the speculum. Okay, tilt your head a little. Okay. Better if you hold it this way rather than this way, so it doesn't touch the patient's mouth. Okay. So, nasal septum is in the midline. No perforations, no lesions, no polyps. You'll have to assess this. It's better if you're looking at it from your patient. No polyps. Nasal mucosa is clear. It's pinkish. Okay. All right. So that is for the nasal, the internal structures of the nose. Oh, you can appreciate the turbinates on this side. Okay, they're like pinkish, very similar to the appearance of tonsils. They're like spongy masses here. So that will be the middle and inferior turbinates. Okay. And then the last part will be the sinuses. So we assess the frontal. No, you can use, just index and middle finger. Anything.
No.
And then for the maxillary, anything.
No.
And then we now percuss. Can you please close your eyes? Anything there?
No.
About here.
Mm-mm.
And here.
Mm-mm.
Okay. So that is for percussion. And then the last part will be for the trans-illuminations. Let me just turn off the light so you can see that. So, frontal. So the red glow.
Mm-hmm.
Alright. So that means the sinuses are air-filled.
Mm-hmm.
Okay. Now for the maxillary, can you tilt your head a little? And then open your mouth wide so they can see that a little more. So that they can see the red glow. On the roof of the mouth.
Oh. We don't see anything.
I don't see anything. Where is it?
Are you congested, Suki?
No. I don't see anything.
Yeah, we do.
See, let me. Visible with her.
Well, what would that mean if there isn't?
Then that means her sinuses may be filled with either mucus, secretions, might be fluid filled.
Are you
Okay.
Do you have sinusitis?
No.
It is, you can see it, but it's very faint. Look over here by the anterior surface of the maxillary sinuses. Okay, so this will be assessment of the ear, nose, mouth, and throat. Any questions? Okay, so you do the assessment of the ear, nose, mouth, and throat until 3, and then we do the breast
The breast.
assessment after.
Okay.